Right, sorry about that, folks. The reason for the delay was I wanted to make sure we had the recording in place so that for those people, for one reason or another, weren't able to make it tonight, we would be able to offer them a recording, and also the people who are on the list. But it's happening now. So welcome once again to our webinar series in the How to Get the Life You Really Want. And as many of you will know, this is ME Awareness Week. And so the special topic which we are discussing this evening is overcoming chronic pain and fatigue conditions. I've used that broad term because one of the things we're going to deal with is all the terminology. But firstly, I should introduce myself. My name is John Donaldson, and I'm the Educational Director of Positive Input. Not everyone on the line will already know much about Positive Input, so briefly I'll summarize. Positive Input is an online learning facility to help people learn about life principles and success skills, all the things that are necessary for a happy, successful life. And it's designed to help ambitious people to achieve more success, more satisfaction, and ultimately happiness. Some people come to Positive Input and just jump in and out to get benefits of information that was given freely on our website, in our newsletters, and in these free webinars. If they're on our mailing list, they get to know about the different events that we're running, and looking after themselves in various ways is one of the things that features very strongly. And then they have the choice to join in with it, whichever events they feel might be useful to them. Other people sign up to become members of Positive Input, and they pay a small amount each month to do our guided online courses and get personalized online tutoring and access to a number of other facilities. Positive Input is a social enterprise, which means it's not run for profit, though it has to cover its costs, and it is at the moment backed by an educational charity called the Huxley Trust. So during this webinar, I'll be talking with Alison Christensen and Mark Bristow, who are both concerned with helping people who suffer from ME. It is Mark and Alison's belief that a lot can be done, not just to alleviate symptoms, but to alleviate causes. Now, they're both on the line, so can I say good evening to Alison?
Hello. Hello.
Hello, Alison, and good evening to Mark.
Hello, John. Hello, everyone.
And how are you this evening?
We're good.
Mark, you're in good shape.
Well, yes.
Good. You're ready for the show? I'm sure you are.
Absolutely, yeah.
Very good. Now, before I let Mark and Alison loose, can I just brief the audience members on some of the technicalities so you can get the most and participate out of this webinar. Firstly, up in the top right-hand corner of your screen, you should see either a small totem pole with 4 little knobbles on it, or you expand this by clicking on the top one, the red arrow, and it opens out to show you a number of other things, which I'm just going to go through. So if everybody's opened theirs out, I just want to check on how the audience is doing. The first thing I'm going to ask you to do is to look at the bottom symbol which you've got, which should be, in your case, something that looks a bit like a hand. And that enables you to raise your hand. So I'm going to give you all a test. Will those people who are on the line click on their hand so I can see if it appears on my screen? 1, 2, 3. It's looking good, yes. Splendid. Right, so we've got that now. Thank you for that. So I'm going to take the hand down. So from time to time, Alison or Mark or I may ask you questions and ask you to indicate whether you agree or not according to your hand being up. You put your hand up if you agree or disagree, or to do whatever's required. Now, the second thing that you're able to do with this wonderful system is you have down at the bottom, I'm just going to look at the other one, a box which should say questions. Now, it might be that it's closed up, in which case you just have the word questions and a little plus sign to the left of that. So click on the plus sign and that opens up, and in there you see whatever questions. And if you want to ask a question at any time, write it in where it says enter a question for staff. I can see it, and then I can pass it on to, my goodness. I can then pass it on to whoever is the most appropriate person to answer the question. I'm just going to put that phone out of reach because it's going to keep reminding me that somebody's trying to ring me. Sorry about that. So we've covered the 2 main things there. So now we can get going. And I'm going to firstly ask a couple of questions which either people can answer, and then they can talk more extensively themselves. So the first question is, and this is really for people like me who are pretty innocent in this area, is what is the difference between all these words? The ones that we've been using regularly are ME, chronic fatigue syndrome, and fibromyalgia. So I don't know who'd care to make some comment on that, please.
I'll go here, Mark. Yeah, what you find is ME is a kind of old word for what most people now call chronic fatigue syndrome, or CFS as it's sort of more widely known. So that these two conditions are pretty much the same. So if anybody has these, they'll understand that as being the same exhausting condition. Fibromyalgia actually means widespread pain. So that is a different condition because that affects, so they think, the nervous system of your body, so that you are actually in agony all the time. It flares up, and it affects you differently because of the pain side of it. So I hope that explains that.
Yeah. So that was what you didn't mention chronic fatigue syndrome. Where does that fit in?
Yeah, chronic fatigue syndrome and ME are the same.
All right.
They're the same condition. Chronic fatigue syndrome is the sort of new modern type name for it. It's CFS is more widely used in the States than it is over here.
Right.
So a lot of books and things you read that come from the States call that ME CFS.
Right. Okay, so does it add up to the fact that all three can be used? They're virtually interchangeable terms for the same condition?
Well, no. The fibromyalgia is a different condition that affects the nervous system of your body. That gives you widespread pain.
Right.
Pain isn't always associated with ME and chronic fatigue syndrome.
I see.
They tend to be, you can get muscle aches from exhaustion, but you don't suffer the same sort of pain as you do with fibromyalgia.
Right. Okay, well that's a very important distinction. Thank you very much for that. Can I go on to another question which is a little bit related? Is there are some conditions which people hear about and they don't know the difference, and it would be helpful, again, my level of innocence or ignorance really in this field is to clarify it for me and for anybody else who needs to know, is that because they're the same, similar, they're not the same letters, but the words ME and MS often get tangled up in people's minds. Could you give us some clarification, please, of what the differences are between the two conditions?
MS is a deteriorating condition that can be diagnosed with blood tests and obviously will be treated as such by your doctors, and comes in various forms of severity. So it's a nasty condition, but it's not the same as ME. ME is, unfortunately, people are unable to diagnose ME with a blood test. And
right.
When you first start suffering from this condition, you have to go through a series of tests where they may well test you for MS to try and rule out what else it might be before they can actually diagnose you.
Right. So are there superficial similarities which can cause people not to be sure in the early stages, or the medical people not to be sure even in the earlier stages, which it is?
Yeah, there's similarities. Because ME is such a personal illness, it can affect people differently, and I think that's what makes it so difficult to give a quick diagnosis on this condition, because people suffer in different ways. But the main sort of symptom is the complete exhaustion and the unableness to be able to get out of bed, which is excruciating. I mean, it's, unless you've had it, it's so hard to explain. It's absolutely soul destroying. So and it makes it much worse for you because you go through these months and months and months of tests, scared that you've got all sorts of sinister things wrong with you before anybody can actually turn around and tell you, actually, we think you've got ME.
Right. Oh, that's scary. I'd like to just share a brief experience myself, which was told to by somebody who's actually on the line. And as a layperson who knew nothing about this condition, had hardly even ever heard of it, what she told me, it was in her worst state, she had a choice of opening her eyes or breathing, but not doing both. And that stayed with me for over 10 years. And, you know, but obviously you're going to give us a lot more information about the experience. But I mean, that really brought home to me
how severe it can be. Yeah, that's a very good description, actually. I can understand where she's coming from with that. That's you know, a very good example. You just haven't got the energy to do both.
Right.
So you're so wiped out. Yeah, very good.
Oh, fine. Well, thank you for clearing that up and giving us, or for the people who are not that familiar, some structure in which to look at the issue. So what I'd like to ask is, and I think because your slide is up first, Alison, would you care to tell us about yourself and how you got to be a physician and how you came to write a book?
Yeah. Well, my story, I never thought in a million years that I would ever get anything like this. In fact, to be honest with you, I'd never, like yourself, I'd never really heard of it before I became ill. I had been dealing with huge life issues for years and years. I thought I had all life had to throw at me. And I had, my oldest daughter was recovering from cancer that had, you know, it had its ups and downs and was very scary at the time. When I first started with pain, I was finding it very difficult to move around. I was sitting up at work, and I was living on painkillers. Because I was nursing my daughter at the same time, the doctor just gave me prescription painkillers, and I just carried on. But these aches and pains got a lot worse. I ended up getting put on steroids, all sorts of medication I had to try and help. Unfortunately, the steroids had an adverse effect, and I ended up in hospital and was taken off all the medication, became very, very ill, and was consequently bedridden for, I would say, about 5 months, where, as your person has described, opening the eyes, breathing, anything that I did was just agony. I honestly thought I'd come to the end of my life. Thankfully, my daughter was on the road to recovery, was a lot better. Actually, our roles reversed. She started nursing me, and I was just devastated. I lost my job. I lost my income, I lost my independence, everything just started going out the window, and I just didn't know how to get better. A couple of times I would have quite happily called it a day, but I just didn't have the energy to do that. I had many tests done at the hospital. I was in and out. They ran everything by me, told me I had many different ailments, and all of them would come up inconclusive or negative. Carried on, and I suddenly realized that if I was ever going to get better, I was going to have to try and find a way myself, and that's when I came across Mark. Now, I have no idea. You know, if you believe in the greater light giving you some sort of guidance, and Mark still has no idea how we ended up emailing each other. I, for some reason, ended up on his mailing list. I have no idea why. I've never heard of emotional freedom technique. I'm a psychodynamic counselor. I counsel people. I don't use alternative therapies very much. So when Mark came to see me, I was a little bit skeptical, but I